Welcome to Health Smart, a monthly health education show brought to you by Hudson Valley Hospital Center. Each month we bring you a new topic and a new guest. This month I'm very excited to have on the show our very special guest, Dr. Arthur Pidoriano. Dr. Pidoriano is an orthopedic surgeon with Mount Kisco Medical Group, and he specializes in orthopedic surgery and sports medicine. He received his medical degree at NY Medical College, where he also completed his residency in orthopedic surgery and his fellowship in sports medicine. He works closely with the Hudson Valley Hospital Center's Center for Rehabilitation and Sports Medicine, and Dr. Pidoriano is here today to talk to us about the sports medicine program and his orthopedic practice. So, Dr. Pidoriano, would you tell us just a little bit about yourself?
Well, first, I'd like to thank you for having me on the show today. And I've been an orthopedist up at Hudson Valley Hospital now for over 20 years. And in that time, you know, I've formed strong relationships with all the athletes in the area and with all the trainers. Actually, when we first came up here, there were no trainers at any of the high schools. So with the hospital, working closely with the hospital, we implemented a program where we got trainers into all the hospitals, we got trainers into all of the schools. Mm-hmm. So now that most of the schools, we implemented a program where the hospital first paid for it, and we offered it as a free service, and then the schools, once they realized how good the program was and how beneficial the athletic trainers were to their athletes, they followed through and hired these trainers. So it's been a good experience working with athletes over the many years.
Yeah, that's great. I mean, I would think that you see a lot of athletes just because people do injure themselves when they are athletic. So probably, you know, orthopedists see lots of people who do sports. I was just a little bit curious about, you know, what types of injuries do you see coming to you, you know, in sports or just in general?
Well, for the athletes, we see anything from fractures to ligament injuries to shoulder dislocations. Probably some of the more common injuries to the knee would be, ACL tears that we see in athletes, mm-hmm. and that's pretty much been a big focus in sports medicine is anterior cruciate ligament injuries. The problem or one of the big issues is that in female athletes is an 8-to-1 ratio of ACL injuries. So for college soccer players, for instance, the study was done, there's 8 times more injuries in a college athlete, a female athlete, than male athletes. So there's been a lot of research into this about, what's the reason for this, and is it muscle balance, or is it even, it's gone so far as to even if they could correlate it with a female athlete's periods, if it was mm-hmm. ligament affected by hormones, and really no one's come up with a great reason. There's a lot of theories about it, but no mm-hmm. one's really solved the problem. What they have done, though, is a gentleman called Frank Noyes, a doctor in Cincinnati, has come up with a program where they can train athletes mm-hmm. to help prevent the injury, which right. is really the best thing we could do for an athlete, is try and prevent the injuries. So there's a whole program, and actually the hospital has supported this program and come up with mm-hmm. through the rehab department, there's a program offered down at Hudson Valley Hospital where they help female athletes prevent this injury in the future. Right. So it's a 8-week training program, and they mm-hmm. come in and exercise and learn the proper way to jump and land from mm-hmm. jumps and try and prevent this injury.
Yeah. So, I mean, I think anyone can sign up for this, right? It doesn't have to be, a school or a trainer or whatever. A parent could call and have their kids signed up for it if they're parents and
absolutely. Yeah, that's just go on the hospital website and through the PT mm-hmm. department. But also it's being offered to specific teams, but anyone can come in and do this training, which I think is very beneficial for any serious athlete that's trying to play at the college level, mm-hmm. Especially a female athlete, to try and prevent these injuries from happening.
Right, absolutely. So let's talk a little bit about some other things that you see in your office and patients coming in. I mean, obviously, people who are athletic get hurt, but there's also other reasons that people come to see you, like, for instance, just wear and tear on the joints. So, maybe an older population of people who come in, people my age or whatever, come in and they're just, having some issues with their knees or their hips or, whatever their joints. And, how do you know when you're, having an issue where you might need a knee replacement, or how does that work when somebody comes into you with like knee pain or?
Well, as you've said, one of the most difficult problems we deal with is dealing with patients with arthritis, because once the articular cartilage is damaged, which is it's the end of a chicken bone, that smooth cartilage you see. Once that's damaged, we really, in medicine, have not found any replacement for that, as far as we can regenerate it, or there's nothing really that has been developed that's as good as regular articular cartilage. So, unfortunately, when that wears out and you get the bone on bone, you progress to a knee replacement is really which can be a life-changing operation for people, where it really relieves their pain. There's a lot of steps before you get to that.
Right. Well, that's what I was going to say. I mean, I think the common knowledge. My husband has knee problems, and there's a lot of things that go, before you actually have a knee replacement, and that, do you want to wait, until you're older because you can only have so many of them, or what's the common?
Well, what I generally tell my patients is, I don't tell you when to have the knee replacement, you tell me. In other words, your x-ray may show that you have bone on bone, but you're functioning at a high level. You're getting by with anti-inflammatory medicines. You're getting by with low impact exercise, all the conservative measures for knee replacements. So you start with low impact exercise, anti-inflammatories. You can progress to shots. There's cortisone shots, which will temporarily improve pain, or there's these viscosupplementation shots,
is that like the gel that you hear about?
Right.
Inject some cushioning gel in your knee, and
exactly.
But does that work, or?
Well, it works in some patients. In some patients, that can buy time, and they can push off their knee replacement. Eventually, they will probably wind up with their knee replacement. But I think those are all good temporizing measures. There's also bracing. If the arthritis is just on one side of the knee, you can do an unloader brace, which helps put the weight on the better side of the knee. So there's a lot of conservative options before you progress to the knee replacement.
Right.
But at times when patients start taking narcotic pain medications and they need that to function, then you're starting into an area where you're probably worse off, and you should consider doing the knee replacement if you're taking narcotics every day just to get through the day.
Right. Well, I think that people in general are afraid of any type of surgery. I mean, do they need to be, afraid? Is this something that seems a lot worse than it really is? I mean, in terms of recovery and what you have today to, help people with a knee replacement? Is that?
Well, I think the big fear for joint replacements is the pain after. I mean, that's what they hear. Patients hear, oh, it's such a painful operation. The therapy is so painful. And I think there's been a lot of progress in this area. In just our anesthesia department here, we're doing everything with blocks now, where you can get a pain pump where it relieves the pain for 3 days, where there's an indwelling catheter in one of the nerves, so it numbs the leg for 3 days, so you're not in that excruciating pain right after the surgery. So there's a lot of developments in anesthesia that have caused a decrease in the pain, and then the physical therapy has improved. And I think all those things, it's definitely shown a lot of improvements in the way we treat patients with knee arthritis and for joint replacement in general.
Right. I mean, I think there's a lot of new developments. You hear every day about something else, minimally invasive types of surgeries and things that help people. I know we had this discussion about this custom knee and what this was about. I mean, in terms of, trying to, find ways to refine the surgery and make it more, personalized and whatever. Maybe you can explain to me a little bit about what's behind that, because I think it's sort of not just the knee, but the technique. Am I right?
Right. So one of the new developments that I've found very helpful is this patient-specific instruments, which is it's a new development that Zimmer has come out with. Zimmer is one of the orthopedic joint companies, probably the biggest one in the country, where we'll take a MRI of your knee, hip, knee, and ankle to get the proper alignment of the joint. And then we can go on the computer and template a knee that will fit to your particular anatomy. So it's a new technique. It's very it's been very helpful in cutting down operative time, in improving results. Because really the best, most knees, when people quote how long does a knee replacement last, because that's one of the big questions we get, are the literature shows 10 to 15 years, but really the most important thing is to put it in correctly the first time. When they take those statistics, they're counting people that have a knee replacement for a year because something was put in wrong or got infected or some kind of complication. So if you put it in correctly the first time, it should last, I mean, now with a lot of the new products, over 20 years. So those are big developments. And this particular knee replacement, the patient-specific instrument and the Persona knee by Zimmer has been very good in getting really good x-ray results and really good alignment.
Right. In terms of the knee itself and the way that it's designed to fit the specific person, I mean, how do you really do that? Is that by weight, or is it by, I mean, obviously gender, because, you know, women and men have different size joints or whatever. Is it, how do they do that?
Well, this particular knee, we'll do an MRI of the knee, and then I will get a input back from the company, which will show me exactly the anatomy of that particular patient, and then I can go on the screen and fit the exact, what the best fit is to that knee. And then when we do the procedure, we'll come back with some of these guides where a specific guide designed just for this particular patient that fits onto their bone perfectly, and then it'll give us the templates to make the proper cuts and get perfect alignment, and that's really what you're looking for.
I see. So it's more like actually designing the knee as you go, you know, like having a guide there to do it rather than them like building a knee and giving it to you. Do you know what I'm saying? It's sort of like a combination of working at it.
Well, yeah, it's using this patient-specific anatomy to get the proper alignment to put in the knee in the most functional positions where it'll last the longest.
Right.
So that's some of the new developments, you know, in knee replacements.
Okay. All right. I mean, obviously, you know, some of the other things are, you know, infection. I know, you know, the infection rates and things like that are very low here at our hospital, but it's you know, some of those things as well.
Correct. That is one of the big risks, but you're right. I think there was some recent data published that Hudson Valley Hospital has had one of the lowest infection rates in the New York area. So
because that's the problem with people having to come back and have things, you know, corrected because of infection and things like that. So it's really important to do that. So that's great. So have you used this on a lot of your patients? Is everybody a candidate for this, or is this like only for certain people, or?
Yeah. So if you can't have an MRI, then we can't use this particular process of making the patient-specific instruments. We can still put in the same prosthesis, but it's we would have to do it the old way we used to do, with just templates and guides, and not with this new technology. But it's still, we can still, you know, proceed with this procedure and do it what we call with image capture. So it's not done pre-hand, but it's done in the operating room with navigation systems where you're looking on a screen, okay, and then you can make adjustments
as you go,
as you're looking at the screen as you go. And that's also an effective way to get proper alignment.
That's like computer guided, or?
It's computer guided, correct. Right. So that would be an option if you can't do an MRI for whatever reason, if you had a pacemaker or something which would prevent you from having an MRI, or metal in your knee would prevent it. So
are knees like hips in that, you know, both of them wear out at different times or at the same time, or can you get somebody who has like perfectly fine, you know, left knee, but their right knee is a problem? Because I know a lot of people who have hip replacements have, you know, tend to have both hips be a problem.
Well, if it's generalized arthritis or a rheumatologic condition, usually it will be in both joints. But if it's post-traumatic arthritis of someone who had a sports injury when they were younger, and then, you know, continued to exercise on it and continued to deteriorate that knee, then it would be an isolated one knee. But it really depends. But in general, like a lot of these things are genetic and you have a predisposition to them. So it really just, everyone's pretty much different with that. But we do see a lot of bilateral knee arthritis or bilateral hip arthritis, as you're saying. That is a common problem.
Right. I mean, it says that there's more than 580,000 knee replacements performed each year, so I guess there must be a lot of people who have this issue with their knees. So.
Oh yeah, it's a common, you know, it's a common problem we see.
Right. So, you know, one of the things that you mentioned that I wanted to get back to was rehab. I mean, you know, one of the things is that, you know, getting proper rehabilitation after any kind of joint replacement or surgery is, you know, really important. And, you know, how does that work with your patients? Do you, I guess, work with our rehab center and others, you know, you know, to get the patient, you know, back on their feet? So.
Absolutely. Rehab is a very important part of orthopedic practice, and working closely with our rehab specialist is very important for a successful patient outcome. Even that includes surgery and non-surgical treatments. A lot of our patients get rehab just to prevent surgery. So we work closely with the rehab specialists and work on programs to try and improve function of patients, try and improve balance, muscle balance, just to prevent injuries. And then when they do wind up having surgery, it's very important to our success really to have a good relationship with the therapist, so that we can get, because rehab is as important as the surgery really in a lot of cases.
I would imagine.
Yeah, if you don't have proper rehab after a lot of these surgeries, you won't get a good result no matter how perfect the surgery is. So it's very important to our practice. We work closely with Hudson Valley Hospital therapists. We have a very good rehab department here, and it's been a great relationship over the years, and hopefully to continue. And I think this new program that they've developed for the female athlete for injury prevention is going to be very beneficial for a lot of the local athletes.
Right. So I mean, getting back to that, you know, we had started talking about that and then sort of shifted away to talk about, you know, knee replacement surgery. But, you know, as far as the sports medicine program here at the hospital that they're developing, you know, who would you recommend to take this? I mean, is it just females that have this problem with the ACL tears, or it's, I mean, I know more frequent because of the, I guess, whatever their biology or their body structure or whatever other causes these tears, but it happens a lot to, you know, other athletes as well. Is that correct?
Oh, absolutely. Well, the particular program we were talking about is for injury prevention of female athletes. So it was designed specifically for female athletes. But as far as any athletes, you know, that for injury prevention, you know, the therapy department here is excellent to work with. So we're not just focusing on female athlete prevention, but for this particular program, because it's such a serious problem in female athletes, the injury rate, that it's more of a preventative program. But in general, yeah, that's true. All the athletes would benefit from a lot of the programs we have here at Hudson Valley and with most of the therapists.
Right. Well, you know, I know things have sort of changed in the sports world, or at least in the high school sports world over the years. And, you know, I know my daughter's a soccer player, and that, you know, a lot of kids, they don't play several sports anymore. They only play one sport. So, you know, I guess there's been some discussion about, well, you're using the same, you know, muscles like over and over again, and you don't really get a chance to sort of spread things around a little bit the way it used to be when people played, you know, different sports in different seasons. So
that's an excellent point. And that is one of the bigger problems we see are overuse injuries. And it is because athletes are specializing at such a young age just to be competitive with the other athletes and to try and get, you know, scholarships or to even just play on the high school team. If you don't play that sport all year, you may not be able to compete to play. So it's an excellent point, and I think especially for sports such as baseball, where there's a repetitive throwing motion, if you don't take, you know, 3 or 4 months off during the year, you're going to develop shoulder and elbow problems. It's almost inevitable. So I think that's an excellent point, and it has to be emphasized. I mean, I see parents come in, and they're just not that they're pushing the kids; they're doing the best thing for the kids that they think, but it's a problem, and you really have to have these young kids rest. Rest is probably the hardest thing to teach an athlete, because they're so, you know, intense and trying to push themselves, and that's why they're good athletes to start with. But to get them to rest or to rehab something is really hard, and that's one of the jobs that I find difficult, is to say, listen, you got to shut it down for a while
Right.
you know, and
Regenerate.
and just let this thing heal, or it's going to chronically nag you.
Right. What is it that you think parents can do, I mean, to sort of prepare their kids for this type of thing? I mean, obviously, you know, whenever you do sports, you have to, you know, you have to warm up. There's certain things that you have to do to prepare your body so that you don't get injured. Do you think that enough of that's being done, or what can parents do to sort of, and coaches or even trainers, to kind of instill this in kids who are playing sports?
Well, I will say, just being a coach, coaching all my kids for these years, it is difficult as the coach to say, listen, we got to stretch. You have a limited amount of practice time.
Right.
Kids are showing up late. You're just jumping into the practice and kind of, so it is a very difficult thing. But I think that's where the individual, I mean, stretching is probably the most important thing that I find is neglected. And the proper way to stretch and to, is different. You know, ideally you warm up for 5 minutes, get a little sweat, and then stretch for another 15, 20 minutes. Right. And that has to be done on a regular basis, or these injuries will occur if you're not properly stretching and doing some of the exercises to strengthen, sport-specific exercises that you need to do to prevent injury. So it is a good point, and it's, you know, it's hard. It's hard because you're driving around to practices, they're getting out of the car, they're all tight, and then they're running right into practice. So it's a difficult problem, but I think the most important thing is to, as you pointed out before, is to really monitor how much they're playing, how much they're throwing. If they're doing too much, you got to back them off. So I think that's the most important thing.
Right. I guess once people show up in your office, though, they've already had injuries. It's not like they come to consult you in advance. Like, you know, we have as you said, the ACL prevention program here at the hospital, where, you know, that's something that you can do before, you know, something happens. But probably most of the people that you see in your office have already, you know, had injuries or whatever.
Right.
So
Usually I'm giving advice to try and,
get them
they've
back.
already had the injury, and I'm trying to just educate them into what they can do to prevent it in the future.
Right, and then I think part of this ACL injury prevention program that we have here also includes some return to sports, because I guess you have to sort of do things just like you were talking about with rehab. If you're an athlete and you injure yourself, you tear your ACL or you do something else to injure yourself, that you have to sort of work slowly back into.
Absolutely, yeah. Before you return to sport, you have to get your strength back so you don't re-injure it. I mean, we're seeing it already on the professional level, where one of the best basketball players in the world really re-injured his leg a year after he came back from an ACL surgery.
Right.
He actually re-injured the opposite leg, but it's
Right.
still, you know, part of the rehab, you know.
Right, because I would imagine that you would put more stress on another part of your body. You know, you're compensating.
You're compensating for something.
So you would probably, you know, have a good chance of injuring some other parts of your anatomy if you're compensating. So I would imagine that, you know, pitchers suffer from a lot of these, you know, overuse sort of injuries that we were talking about. Is that something that you see, and what kinds of injuries do they get?
Yeah, so pitching injuries are very common. In a younger pitcher and a younger player, the more common injuries are to the labrum, which is the lining of the joint, the socket of the joint. There's a rim of cartilage around the glenoid, and that is often injured in younger pitchers. As they get older athletes in their 30s, 40s start to have problems with the rotator cuff. The key is, though, in a lot of these injuries, they can be successfully rehabbed without surgery. And it's important not to just focus on the shoulder, and that's where our therapists are so good at, and to focus on the whole core, and it's the whole kinetic chain really that can be a problem. And they need to analyze that and see if there's any muscle imbalances where even in their lower body and abdomen, if it's not properly strengthened, it will affect how their shoulder's positioned, and then ultimately affect the shoulder function, and then cause injuries. So I think those are all important factors when we look at a patient with shoulder pain. You know, where is it really coming from? Is the shoulder a secondary thing, or are they compensating? And then ultimately, if they have torn something that has to be fixed, you know, we have there's been really a lot of advancements in shoulder surgery techniques to do everything minimally invasive, and arthroscopic repairs of rotator cuff, arthroscopic repairs of the labrum, which can allow the athlete to get back quicker to their sport.
Yeah, I mean, I think that's a great point what you were just saying about how people don't realize that, you know, the rest of your body's involved as well. It's like they come in for an injury and say, oh, my knee hurts or my shoulder hurts, and a lot of times it's really the relationship of everything that you're doing in your body, like, you know, are you sleeping the right way? Are you, if you're a runner, you know, how are you running and what kind of stress are you putting on different parts? So, you know, when they work in rehabilitation, they spend a lot of time, you know, analyzing your entire body and the relationship. So.
Absolutely. So, and that is important because the therapist is with them for a lot longer period of time, and they can pick up on some of these subtle imbalances that will be helpful to that athlete or that patient.
Right. So that, you know, I think we talked about a lot of different things, a lot of different patients that you see. I mean, obviously we focused a little bit on the knee, but there are many different things. I mean, you pretty much specialize in knees, or you do other
knees
surgery
and shoulders.
Right. So, but you know, there's all kinds of joints in your body. You guys, your practice does hips and elbows and everything else.
See
so
everything. Yes.
that's it's quite diverse. So, I mean, if somebody wanted to reach you, you practice here. You have an office here at Hudson Valley Hospital Center in our new medical office building,
yes.
And you have another office, correct? Is that
at Jefferson Valley?
In
yes.
Jefferson Valley. So they could just contact your office.
Absolutely, they could contact. I think there's a Hudson Valley website.
Mm-hmm.
The hospital has a website.
Right.
Also, I'm part of Mount Kisco Medical Group, so you can go on their website and it shows all the offices I'm at and how to make an appointment.
Right. So anybody with any type of orthopedic issue, whether it's, you know, arms or legs or knees or ankles or whatever, can contact your office and have somebody take a look.
Absolutely. Thank you.
Great. Well, it's great having you on, and you know, we're really excited about having Dr. Pidoriano involved in the sports medicine program here at Hudson Valley, because I think there's a lot of, you know, athletes who can benefit by this and kids in school, and I know you work with a lot of young kids, so this is a good thing and a good relationship, and it was great having you on the show.
Thank you very much. I appreciate it.
Okay, I hope you enjoyed this evening's edition of Health Smart, and I hope you will join us next month when we return with a new guest and a new topic. And until then, be well.